This week on the BackTable podcast.
We've had tumor boards, we've had journal clubs, we've had pathology committees of really thought leaders who have had these basically webinars to educate pathologists around the globe on how you diagnose some subtle different dedifferentiated tumors of subtypes and really understand the fundamental knowledge they need to do and apply in their practice, which they may have not gotten throughout their training. I think that, to me, disseminates the impact of our society.
Hello, everyone, and welcome back to the BackTable podcast, your source for all things urology. You can find all previous episodes of our podcast on iTunes, Spotify, and at backtable.com. Now, a quick word from our sponsor. This discussion is brought to you by Veracyte, provider of the Decipher Prostate Genomic Classifier. Decipher Prostate is a test for patients with localized prostate cancer that can help personalize treatment. Every patient and their prostate cancer is unique, and Decipher Prostate can provide meaningful insight into the aggressiveness of each individual's patient's tumor. Because the Decipher score is derived solely from the genomic characteristics of the tumor, it provides information not available through already known clinical and pathologic factors. Decipher high-risk patients generally benefit from earlier or intensified treatment, while Decipher low-risk patients may be ideal candidates for monitoring or less overall treatment. Decipher Prostate is the most validated gene expression test in localized prostate cancer, with level 1 evidence in national clinical practice guidelines and more than 70 peer-reviewed publications, including more than 65,000 patients. Visit Veracyte.com/Decipher to learn more. From concept to completion, there's a lot to consider when building a Theranostics or PSMA PET-CT imaging program. It's nearly impossible to be an expert in every aspect of this care pathway, but the success of your program depends on it. Get the support you need from an experienced team. Open your web browser and search Siemens Healthineers Theranostics. You'll see the complete Theranostics care pathway and how they can help you customize it to meet the needs of your prostate cancer patients. Visit their website or stop by Siemens Healthineers booth at the local and national American Urological Association and large urology group practice association meetings. You deliver the care, they'll deliver the rest. Now, back to the show. This is Aditya Bagrodia as your host this week, and I'm very excited to introduce our guest today. We have Philippe Speiss, who's a professor of oncology and urology at Moffitt Cancer Center, and we have Andrea Necchi, who's the director of Genitourinary Medical Oncology at San Raffaele Hospital in Milan. Phil, Andrea, how are you all doing today?
Great, thanks. Thanks for having us.
Thank you for the invitation, and pleased to welcome.
Well, I'm super excited about this. I was just kind of thinking about the progress, even in the course of my career, that we've made in rare cancers. And it's really been the Herculean efforts by folks like Phil, Andrea, Chirac that kind of obviously come to mind. So let's jump on into it. Maybe I thought we'd just start out with some basic definitions. Rare GU cancers. What are we kind of talking about here? And then what are we talking about specifically in urology?
So I think you've really highlighted, an important critical question that we all have when we sort of define and develop the society is the definition of a rare cancer really depends on the source. It's defined obviously on a cancer which is very infrequent, the NCI, and European societies have different definitions of it. Obviously, most of the time that it is defined as a cancer typically less than a 1% incidence. Sometimes they talk about overall number of cases. But your point's really well taken because rare cancer is a relative term. Depends where you live, depends on what you're seeing in terms of expertise. And for patients, it really makes it, a struggle is, prostate cancer in some parts of the world is a rare cancer versus peanut cancer in other parts of the world is actually a very prevalent cancer. So we wrote a recent editorial in European Urology related to this saying, we really can take a step back on having this holistic, this is the incidence of rare cancers, and really understand that it is absolutely relative term, and that's where a global society dedicated to this can serve as a central resource for people around the world.
Yeah, I echo Phil's word. The concept of the rare tumors has very much to do with the concept of orphan disease. And it is not just a matter of numbers because It is also a matter of geographical disparity, for example, because a rare tumor like penile cancer, which is rare in Western countries, is not rare in other countries like Brazil or South America. And since the very beginning, Phil and myself, we felt the fact that people dealing with the rare tumors, or maybe people working in underrepresented countries like India, Africa, South America, though managing frequent tumors, were very similar to those people dealing with rare tumors. So another very important point to make when dealing with our society is not just the fact that we focus since the very beginning on rare tumors, but the fact that we aim to coagulate people from underrepresented countries, from people that are far from the forefront of the developments in medicine and in oncology, or developments in new treatments, development in access to new therapies and so on, trying to put them at the forefront of the developments together with us. This is another important point that moves in parallel with the fact that we are dealing with rare tumors.
Yeah, I absolutely appreciate that. And I think the rare tumor is kind of nomenclature is just going to continue to expand. I mean, you think about prostate, we have neuroendocrine, we have variant histologies. As we get more molecular definitions and subcategories and subcategories, this becomes even more critical and pressing. And I love that, Andrea. You know, Gagan Prakash is a good friend and colleague of mine. And I think looping in people who have a total different perspective on things, the populations they're treating, the resources that are accessible is tremendous. So let's just maybe kick off with, you know, the Global Society of Rare Genitourinary Tumors. What was the kind of idea behind this? Why is this necessary? Where did this come from? I think this kind of genesis story would be super interesting to our listenership.
So, you know, it really is a great story and a great partnership, and I really credit a lot of this success is really having a wonderful partner in crime in Andrea. You know, we were doing a lot of research collaborations together. You know, Andrea has had a lot of focus in his career in penile and testicular. And I remember about 6-7 years ago, I reached out and we started these collaborations in penile cancer research. And it was very evident to us as we did this that there were many parts of the world where they were seeing a significant number of cases, but they basically had no publications or access to sort of report a lot of their data. And it sort of led to a conversation we had saying, you know, I think it's time that we sort of focus to develop a society in this space. Is, you know, credit to ASCO, ESMO, EAU, AUA. They do a really great job, I think, advocating for patients and highlighting many of the diseases, but the rare cancers simply just don't get much attention related to large organizations. And so a focused society, which would be really gathering experts in this topic across the globe, making sure that there is representation, to Andrea's point, from parts of South America, from India, to provide us and understand some of the challenges in some parts of the world related to the care of these patients, access to trials, access to expertise in pathology, radiology, and have them really become partners with us to really, first of all, elevate the quality of care in many parts of the world, but also advocate that they become active participants in research was really impactful. And I think as a consequence of that, I think it led to multiple publications, but most importantly, collaborations to elevate the quality of care that's provided in many parts of the world. And there was just a very strong, I think, impactful, experience. And it's really nice to see, you know, as you know, when you start a society like this, you're two people. You can't do it all, nor do you want to do it all. So we've identified, I would say, rising and superstars across the globe have sort of taken ideas and ran with it. And it's nice to see that it's, you know, from an idea and a concept, it's really become something which has become very global in the representation and the initiatives that it's sort of taking place in.
Yeah, we were facilitated, I would say, since the very beginning by the fact that the society was conceived in just after the first COVID wave, hard wave, in July 2020. So our first move were virtual, and and mainly our primary activity is still virtual, and we were facilitated because of the fact that we lacked budget to afford in-person meetings. So we were able. At that time, basically everything was virtual, so we were facilitated by the fact that we were able to connect people and to organize meetings and to organize grand rounds virtually, because everything was virtual. So for sure, at least in this case, COVID helped us in the first move, gathering and coagulating at least the core business of the people that are working with us in the society. And another important point to make is that if you look at the other societies, like in Europe, for example, if you look at the ESMO society, there is a well-established branch which is dedicated to rare tumors. The ESMO Rare Care Initiative is a huge initiative that is running in Europe since a few years ago. But the definition of rare tumors, basically sarcomas, head and neck tumors, melanomas, and a few others are included. So my impression was that GU cancers, and maybe it is still, that GU cancers are still at the angle of the societies, of the branches of the societies that are dedicated to rare tumors. So a focus on primarily on GU oncology was needed in this. It is why the GSRGT has taken too much interest so far and has coagulated so many people involved and interested in our activities.
Yeah, I appreciate that. And, kind of preparing for this chat with you all, I kind of took a walk down memory lane when I was a trainee and learning about rare tumors, how to manage them. Essentially you're looking at case series from larger institutions. It's hard to kind of really do much beyond here's what they do, here's what we do, here's what seems reasonable. And maybe I ask you to do two things. Perhaps take a walk down memory lane yourselves on how some of the rare tumors were treated, diagnosed, managed when you were in your earlier career. And then two, just talk a little bit, it may seem obvious, about the challenges of studying rare tumors.
So, I think that's a really great question. And you're right. It is interesting. I remember giving a talk a couple of weeks ago on peanut cancer, and I was just telling the trainees that the paradigm has changed so much related to how aggressive we are, right? Is when I trained, when they had a primary tumor, you had to need to get a 2 centimeter margins, and there was no question about it. And unfortunately, a lot of patients got some fairly aggressive, invasive, and potentially debilitating surgery. So that's still being done in some parts of the world, basically because that's what they've been doing dogmatically as the professors who've been doing this, and it's not necessarily reflective of where the field is. And that sort of really highlights, I think, the importance of disseminating all that information and making sure that number one is that the people who are caring for the patients are aware or where the state of knowledge is, or if they aren't, that they're readily able to identify who are going to be great resources in our healthcare systems that refer those patients. And you made me also think, recently we just wrote a review article on urethral cancer, another really rare one. And the question that sort of came to be as we were putting this together is exactly to your point. It is all retrospective. It's based on a small number of patients. And we base our decisions today on these types of questions and studies. And you sort of take a step back and say, how are we in 2024 still doing this? And that's where I think a society like ours has a unique opportunity. And I think to gather, global leaders to say, okay, we need to improve the level of evidence and what we provide to patients. And I think we have the opportunities to do that. Obviously, not much funding in this space. You're not going to get millions of dollars funding to do it. But I think if you get the right thought leaders who are eager and are invested and understand the critical need, I think you could be very successful in doing that. And that's what we're seeing is we're able to do these types of studies, which others haven't been able to.
Yeah, I love that.
But in GU cancer, there is the example of testicular cancer, which is a very good example of a way of coagulating people in common endeavor, like even in clinical trials. And the TIGER trial, the trial that is currently worldwide evaluating high-dose chemotherapy versus conventional dose chemotherapy as salvage therapy for metastatic patients, was successful in coagulating people from many countries in a unique clinical trial. This is a unique example in GU oncology, and it is an example of not so many in oncology in general. So testis cancer is a good example of this kind, and I think that in general we can look at the examples provided by pediatric oncologist organization, also dealing with rare tumors, that are very, very strong in establishing partnerships and establishing common endeavors and global prospective studies. So we do have examples that we may take advantage from in geo-oncology. And I personally love testis cancer since the very beginning, because I started as a hematologist by education. So at that time, my focus when shifting the interest to solid tumors was primarily testis cancer, because testis cancer people were dealing with they were treated with high-dose chemotherapy. So I started with treating them in the urology department of my center. So it was to me my first love, because it was to me my first platform to test the abilities for not just building a career, but building a team, a multidisciplinary team within a surgical department. So the first example, the first challenge, or many others that followed, it was pretty much the same. So the abilities of establishing a new group, the abilities of establishing a work, the multidisciplinary fashion. So to me, it's a very good example of in my career of how can we develop new things starting from almost zero. So I very much love testis cancer, and in this case, testis cancer put in the GSRGT.
Well, that speaks to me, Andrea. I'd say clinical research interest is testicular cancer, and some of the things that you're saying really, really resonate. It's I think sharing that passion, inspiring a team. I think we're doing better, and I feel like the Europeans and the children are better than the Americans, quite frankly, in this collaborative approach. You hear about vulvar cancer and how much progress has been made and how far behind we are on penile cancer. I mean, COG, it's like every patient's on trial. And I kind of get the sense that the egos are kind of put aside, and let's all do this together and do it for the patients, as opposed to it's got to be a me thing or an us thing or a my institution thing. And we've seen successes. I mean, Vitaly Margulis, a mentor of mine, neoadjuvant upper tract collaborative ECOG study. Impact, of course, Phil and Curtis, Andrea, you guys are intimately involved with that. POUT, poster, it's really exciting and empowering that we can do high quality work if we work together. And it doesn't need to be single institution retrospective reviews. I think that to me is incredibly, incredibly exciting. And so the passion is very obvious from both of you all. And maybe I'll ask you to just talk a little bit about, some of the real successes that have come out of this organization, a couple of examples of things that you're, particularly proud of or that have moved the needle forward.
Yeah, let's change it up. I'll let Andrea go first here.
Well, first thing I'm particularly proud of is for sure looking at the roster of the people that are part of the core business of the society, the variety of people that have joined our society, the geographical variety, the ethnic variety, so the gender balance in our society. So having reached these endpoints that are critical in every society today, so reaching the gender balance, an ethical balance, a geographical balance is one of the most important goals. And one of the most difficult goals when establishing something new today that is pretty much criticized and considered under heavy scrutiny from everyone, particularly today in where we are living within social media. So we have to take care of everything because we may be criticized from many aspects of things that we do. So this is for sure a goal that we have achieved within our society, and the activities and the kind of the level of involvement and commitment of people working in our society. I thinking about Gagan or Indian people or Karim Mawala from Africa. So these are, for example, today there are two pillars for our society, from the African side, from the Indian side. So just having established something like this in just 4 years or so is not something that was easily conceivable at the very beginning, and we are expanding. So the level of enthusiasm that is actually translating to the number of publications that are made on behalf of the GSRGT. If you go to PubMed, you are able to see we have published in a good way in these years, but particularly having involved people from this kind, from very committed and very much various from under many standpoints.
Yeah, I think those are all excellent points you raised, Andrea. And I think, there's a lot, I think, to be proud of here. Number one is, in addition to the fact we're able to really gather thought leaders, what I've been really impressed to see is, for example, our adrenal tumor committee has developed educational tools readily available, has provided, a quality review on the topic with really top thought leaders from across the globe. And they did this really as a critical need. I give a lot of kudos to Alex Kudikoff, who did this with a really talented group of people. And then you also look at some of the, educational venues we've had. We've had tumor boards, we've had journal clubs, we've had pathology committees of really thought leaders who have had these basically webinars to educate pathologists around the globe on how you diagnose some subtle dedifferentiated tumors of subtypes, and really understand the fundamental knowledge they need to do and apply in their practice, which they may have not gotten throughout their training. I think that to me disseminates the impact of our society. And then, you look at some of the publications that we sort of generated. We've been able to ask questions that I think, unfortunately, has not been able to be looked at in clinical trials. And I think of this recent JNCI paper that we had looking at immunotherapy in penile cancer. Everyone has anecdotal cases of 1 or 2 or 3 patients who responded to Keytruda. But this was a global paper looking at the world experience of using these agents. Bottom line, showing that they simply don't work for most patients. And there's many studies like this being sort of conceived, planned, and probably will be published. But, these things are being highlighted at major scientific venues across the globe, whether that be a European meeting or that be ASCO GU. I think in the pipeline, we have some really impactful things and studies that are coming through, including in testicular cancer, that are very exciting. And I think the next venue we're definitely embarking on is trials. Is how do we use the society as a pivot point to do clinical trials? And I credit Andrea with that concept. He's brought it up a while ago, saying, I think we have an opportunity here, to bring parts of the world that have not been able to participate in trials just because simply they may not be a very appealing market or a small market for companies and industry to participate. But I think that's where a large society with global representation is able to sort of engage them to participate in studies. So I think that's where we're going to have a greatest impact in terms of advancing clinical care for patients.
This is a very important point that Phil has made. So the ability to provide networking and the network for centers and investigators that may be involved in clinical trials is pretty much appreciated by the companies. So we can establish as a society an academia industrial partnership of this kind, not being able at this point in time to sponsor and to promote clinical trials because we don't have the budget as many other societies in this area. But this kind of partnership and the provision of a network of centers even in underrepresented countries is today one of the major focus and my major interest also by the companies that are working in rare tumors.
So I actually think Phil and Andrea are being a bit modest and humble here. I've had the good fortune of attending some of the webinars put on by the Global Society, as well as participating, seeing the research output. And I think the education, awareness, community building is just tremendous. The quality of speakers and content is ultra nuanced and relevant. First things first, just making sure that committed people understand the state of the art is amazing. And it's not just collaborative outcomes research. I mean, really fairly next level. I have the good fortune to work with Roger Lee on some of the molecular characterization efforts. It's high quality, it's integrated. And I kind of get the sense that the society's using their prominent places in non-rare tumors, prostate, kidney, bladder, using those contacts and say, hey, if you're going to support these financially appealing cancer types, you have to also support these rare tumors. We see it here for a prostate cancer patient summit. There's a line out the door of vendors that want to sponsor. And then for the testis cancer patient summit, it's like pulling teeth. But we leverage our spot and say, we are high volume users of X, Y, and Z. Where is this coming for our rare patients? And I felt like I was kind of hearing that a bit from you, Andrea. Is that accurate?
My answer is definitely yes. My idea is that what we need in principle, is to have a suitable biomarker from which to start the entire story. This is the case for FGF receptor genomic alteration in urothelial cancer. This may be the same for SPOT mutation in prostate cancer or VHL mutation in renal cell cancer, opening up the door to VHL societies and our collaboration with the VHL Alliance, for example. And this also may be the case in the near future for pineal cancer because of the fact that we followed the publication that we did recently on behalf of the GSRGT and collaboration with Foundation Medicine people and Jeff Ross. We focused on the attention on HPV, human papillomavirus infection in pineal cancer. Provided that this may be a very valuable endpoint and the end goal and the biomarker for immunotherapy approaching in pineal cancer, we can establish the first step towards a next clinical trial and building a next interest for the companies to invest in pineal cancer. So the story is repeating pretty consistently across the disease types, across the tumor types. So what we should start from is the knowledge, acquiring the knowledge and the information about the one single biomarker that may be potentially suitable for a certain approach, certain therapeutic approach, and start building from this and benefiting from this also from the society standpoint, from the collaboration standpoint, from the interest standpoint, patient advocate standpoint. Everything starts from here. So it is a nice story that starts from a scientific level and moves to the patient involvement, people involvement, interest, collaborations, and so on. So my primary focus will be on biomarkers in this endeavor.
And Phil, maybe I'll ask you to expound a bit on that, on how you feel like the collaboration, which is still in its early years, admittedly, has enhanced innovation, research quality, patient outcomes, guidelines. Are we getting there? You know, do you feel like when you reflect back on the past 4 years that you're like, man, we've come a long way. Still work to be done, but we've come a long way.
Yeah, there is no question. I think that, as you said, I think a lot of our foundational initial work was to try to start by starting in increasing overall knowledge, and I think addressing some of the gaps in clinical care, like pathology, quality of interpretation, quality of standards on how patients are being cared for. And it is impressive to see just through some, collaborations and major reviews that we've done, some of the thoughtful feedback that we've received from global representation saying the initiatives you've done have allowed us to elevate how we care for our patients. I've gotten emails from colleagues in South America, for example, who said, they clearly see what the mission of our society is. They clearly see that, we're able to sort of disseminate critical information they may not have access to. You mentioned Gagan Prakash. He's been an incredible ambassador for our society. I think he's taken a lot of the information and things we've worked on, such as global surveys in the care of penile cancer, and showing there's a huge gap and discrepancy on how patients are being cared for, whether that be in timing of diagnosis, management of the primary, utilization of neoadjuvant chemotherapy, surveillance of patients. But these efforts, particularly with representation of people across the globe, again, not only North America and Europe, but really of India, of South America, has highlighted that there is a critical need. And a lot of that information has gone back to the societies and to individual clinicians to try to elevate that. Now, you mentioned it. This is early. I think our focus is we've tried to be tactical, not to take on all disease sites. And I think you mentioned it. I perfectly agree with what you mentioned, Aditya. I think, as we all know now that we're sort of treating patients today, it's not about prostate or kidney cancer. We clearly know genomic profiling is driving everything, and we're not too far from genomic signature type of classification and staging of tumors. So that is where we're going in terms of, disseminating and improving the clinical care. And I think, to Andrea's point, clinical trials in this space, particularly in ones where there's not really optimal treatments. And I think we've been very lucky too. I think Jeff Ross and Foundation Medicine have been great partners through Roger Lee's committee in Bladder to really saying, okay, we have a great resource of information. We're happy to partner with you to answer those questions. And it is really great to see that anyone that we've approached ultimately in terms of partnering has sort of embraced the opportunity to do so. So I think it is very exciting. I know tactically right now we have some great initiatives in testicular urethral cancer. The adrenal committee is very active, but also I think we're doing some early work now in sarcomas and melanomas, things that many of us, even if you do treat rare cancers, don't see many of. And honestly, when we see them in the clinic, we sort of still scratch our heads in terms of management. That's really where we're sort of going to in terms of developing those committees, understanding that we want to sort of partner with people who are engaged in doing that.
I have to just reflect on a recent experience. I had a 83-year-old female with a urethral distal melanoma, and largely through this committee, I called up Phil. I was like, Phil, you've got to be kind of like a world expert on this. Like, I've got a sense of like what might need to be done, and it was incredible. I called him up. Let's have a chat. What's going on? At least I can give the patient like some idea of what comes next. And even when talking to my medical oncology colleagues that are melanoma experts and surgical oncology colleagues that deal with melanoma day in and day out, I felt a lot more informed. I think this, sometimes this idea of community, being able to kind of phone a friend about these ultra rare scenarios is so nice. So, I personally, of course, appreciated that. And I think it's really establishing this network, which Andrea pointed out as the first major milestone, is just to get a group of diverse people with diverse interests, backgrounds that are engaged is invaluable. So we've talked a little bit about where you've been, and you kind of touched on it in terms of where you're going. I mean, I think some of the things are going to be fairly obvious in oncology, molecular profiling, genomics, artificial intelligence, maybe microbiome, and perhaps it's not done everywhere, but it's done at some centers that can do it. But as we approach 45 minutes or so, I'd love to hear a little bit about future directions, clinical trials, what really gets you excited about the society, and when you reflect back in another 4 years or so, thinking about, an ideal state.
Well, I think that's a really good question. I think it is exciting for us. I will tell you, I've been humbled in the sense, again, I've had a really great partner in crime in Andrea. And as many of you who've worked with Andrea, you give him an idea, he runs with it all the way. And, he's just very driven, focused, and bottom line, always sort of committed to the mission. So I couldn't have picked a better partner in crime. And I think where we're going now is obviously he's a global leader in GU clinical trials. So I couldn't have picked a more perfect partner to disseminate and expand on developing clinical trials in this space. I'll reflect on my experience with IMPACT. So as many of you may not or may know, that the IMPACT is a international study. We're currently looking in terms of multimodal care of patients with node-positive peanut cancer. And Curtis Pettaway has been an incredible ambassador with Steve Nicholson for this study. But what I've been really reflected at is it is incredibly difficult to do these types of trials globally for many reasons, whether it be politics, whether it be finances, whether it be getting all people to agree to do this. So to me, this is a landmark trial for many reasons, but it also highlights to me that it is incredibly challenging through current, I think, infrastructure to do this. So if we're going to do this successfully in the clinical trial space, it's going to take a global society to do this. Now, we're not saying that we want to take on everything. We need to partner. I think that, I think there's a really great, innovative, systemic therapeutic approach in peanut cancer, for example, that are being developed. But to be successful and to accrue the patients you need to do this as international studies. And I think that's where we can be successful. Very similar to some of the great work you've done, Aditya, truthfully, in biomarkers and testicular cancer. I think a lot of this, we have opportunities to validate a lot of these things through global, trials and partnerships. So I think those are the types of things we are very interested in working with. And I think that, to me, is going to be where we're going to have the greatest impact. And I also want to sort of give a plug to, I think, some really talented colleagues. Again, Aditya, you're doing some great work in patient-reported outcomes. Scott Gilbert as well at my institution. But I think that's an area that has not gotten enough attention for rare cancers. I think defining what are the important patient-reported outcomes, developing the right tools, making sure that those are integral in the clinical decisions we make for patients, and that clinicians are in tune to these. Those are critical things. And I think now, particularly with AI, and I think some of the novel tools for patient reporting, I think we have opportunities for us to sort of lead and sort of partner with companies and industry to do this as well successfully.
I love it. Andrea, let's hear from you.
Yeah, I can only echo the Philip's words for sure. That I was fortunate to meet him and to find such a visionary surgical oncologist like him, and establishing a good friendship with him since the initial times. I think these are qualities that are very rare in surgical oncology in general by education. So I have so many credits to fill in for everything that we have done in these years. I think that Phil has already touched the scientific standpoints for the potential next developments. From the scientific standpoint is there. We do have a lot of potential partnership and potential developments in the near future. What I would like to focus a little bit on is on the educational path that we can provide to young people. So I would foresee a near future in which we will be able to afford a career with young urologists or young oncologists or young people, young investigators that are interested in building their career in GU cancers, and maybe affording fellowships in very special topics, like, for example, fellowship to spend in Africa to develop HPV-driven activities or HPV-driven studies, or fellowship in India or fellowships in South America for certain specific endeavors. So what is likely to be launched in the near future by us as a society is an initiative of this kind for young, talented people interested in challenging their career in this very, very hard to manage path. And I think that it may be rewarding. I remember not so many years ago, that an effort of this kind in gynecologic cancer was chosen as a profit paper in a plenary session at ASCO. So if people are intelligent enough to look at the possibilities, I think I'm pretty sure that a lot of these talented people would be interested in this kind of activities. So what I would expect for the near future is to focus a little bit on this kind of educational activities also in parallel with the scientific developments that we can provide as a society.
I think these are tremendous initiatives, and that absolutely seems like there's a critical mass, critical momentum to make it happen, and hopefully along with that comes some fundings, either through industry support, philanthropy, that can make some of these things that do require resources a reality. From my end, one of the things that also strikes me about the society is just how welcoming and inclusive it is. As a youngster, which I think I'm squarely not a youngster anymore, sometimes societies seem a bit intimidating, a bit removed, that it's a kind of who's who of various disease state, and you feel a little bit odd trying to get involved. But my experience has been the diametric opposite, where there's this ultra warm welcome for people that are interested to get involved. So if I may, the sense that I get is that you're always recruiting people that have passion wherever they are across their disease path. It's never too late. Any contribution is welcome. So maybe I'd ask you to comment on that, provide some ways to get involved, contact information, some concretes, and then maybe just some parting thoughts from each of you as we get close to concluding.
I think it's absolutely something you mentioned that really, I think, hits home. Is I'm always very, I think, touched and I think impacted when I hear of people across the globe just send me an email or reach out saying, hey, I want to get involved. What can I do? Clearly people are not getting paid to do this. It's coming clearly because they see that this is a critical mission and it's something they want to engage with. So we're always looking. We're looking for people, could be urologists, could be oncologists, could be pathologists, medical oncologists, radiologists. If you have an interest in rare cancers, rare GU cancers, whatever those may be, and however you define those, whether it be on variant histologies, disease sites, we welcome engaging you and partnering you with some of our committees and initiatives that are taking place. The fact is we can't do it all, but the fact is we're always looking for very talented, very motivated people. And we all know sometimes some of our brightest and youngest scholars have some of the most innovative ideas we may have never thought about. So we always love the idea. If you're definitely interested, reach out to us through our website, through social media. Gagan Prakash, we can get you his information, is in charge of our membership with his team. We're definitely happy to sort of see how you can get involved. And I can promise you that it will be, I think, something which will be impactful not only for your career, but for the career and lives of many patients and families. I definitely think my parting words, and I'll leave the rest to my good partner, is as I reflect on my career, and I don't want this to be like a lifetime achievement thing, because hopefully way more to come, is you want to sort of have an impact on the field. We've all published papers. Some of the public papers we publish were CV fillers, if we're going to be very honest, and it's where things that are innovative and ask questions. But when I sort of ask myself, what do I want to accomplish in my career? I want to make it a better place for patients, families, and my colleagues. And I think when I sort of look at it, the society has allowed us to do so more impactfully than anything I've done personally. So I'm very proud of the work we've done. And I'm very much looking forward to a very bright future working with really talented people.
Thanks for that, Phil. Andrea, let's hear things from your perspective.
Yeah, very, very brief messages that to all the young, talented people that would be interested in developing a career and collaborating with us is that your voice will be heard and will be taken into serious consideration. All your requests will be taken in serious consideration, as we did since so far. So it is not so easy sometimes, even at the university level or institutional level, to be heard for young people. I mean, to have their voice heard and their comments or their expectations heard regarding their career. So at least as a small example in the world, we can provide them with the possibilities that we may provide that are in our hands to provide in the field that we are dealing with. So this is one of the most important messages that we can provide to our peers and to our colleagues and to young colleagues in particular, added to all the rest of the activities that are for sure dedicated to the patient primarily.
Well, Phil, Andrea, thank you so much for your time and sharing the story of the Global Society of Rare GU Tumors. It's inspiring to me and also very exciting for the work to become. I've absolutely enjoyed having a role with the society. It's really exemplary in every dimension. So thank you. I'm glad we were able to do this and look forward to a series of collaborative projects between BackTable and the Global Society covering some of these super important topics. Thank you so much.
Thank you. Really appreciate it.
Thank you very much.
Thank you so much for listening. If you haven't already, make sure to subscribe, rate the podcast 5 stars, and share with a friend.
If you have any questions or comments, DM us at _BackTable on Instagram, LinkedIn, or Twitter.
BackTable is hosted by Aditya Bagrodia
and Jose Silva.
Our audio team is led by Kieran Gannon, with support from
Josh McWhirter,
Aaron Bowles,
Josh Spencer.
Design and digital marketing led by Brian Schmitz.
Social media and PR by Chi Ding.
Administrative support provided by Jamila Kennebrew.
Thanks again for listening, and see you next week.